Thank you very much for joining us today. Gordon and I are really happy that you could join us, especially in this time of COVID. It's wonderful to be together in some forum and to share. So thank you very, very much for coming. I am Carmen Hoost. I am a nurse. I am I teach nursing. I teach at Algonquin College, and I am a certified psychiatric mental health nurse. So that's my passion. My own research focus has been student mental health. And right now, of course, we're living with COVID and all of our students are online. And we're now looking at how are we supporting and nurturing their mental well-being, as well as providing them with education and so on and so forth. But this whole story is very dear to my heart. And the kind of research I tend to do is a lived experience, so phenomenology, so asking people for their stories and what is that experience like, and learning from that experience. So this presentation is imbued with my interests and Gordon's interests, and we can even consider it a dinner conversation at the Cuban Houstonics, as we're sometimes called. So thanks.
Hi there, I'm Gord. I'm a lowly engineer, and I have had the experience of a daughter with some mental health challenges in the past, so that was my introduction into this years ago, and ever since then I've had the radar fine-tuned to notice when things just sort of are a bit off. And I've been noticing through stories, mostly from my kids, from their friends, and changes in their lives, that there's something going on here which is been under the radar. It's starting to hit the news right now, and so that's where some of the strange stories were told to me, and that gave the idea to do this presentation. So without further ado, we'll get the show on the road.
Oh, no, it's not kicking in. So okay, so what
all right, I don't notice. It's not going to work.
Okay, wait.
Okay.
Wait.
All right.
We'll just go back to share screen. Are we in the right screen?
Now we are.
PowerPoint. No, we're not. Let's see.
That's not ours. It's a PowerPoint.
Okay. PowerPoint.
It's not advancing.
Sorry, we're okay.
We are? No, it's not as.
There you
there
go.
It goes. Okay. So we're going to chop this up into 3 bits. Carmen will do the most of the first and third bit, and I will do the middle bit mostly. The image sort of sums it up, is that there's an expression in mental health that mental health is health, and separating out physical from mental, from social, from financial, etc., separating them out is itself the issue. So we'll jump right into a couple of punchlines. So we're going to tell you and then tell you and then tell you again. So here's the first time. Life knocks us all down. And when we are connected with others in mental health, we basically, most people can recover. And there's lots of focus that you'll hear from Carmen about recovery when we're connected. When we're connected to the world, reality, each other, our emotions. It's the connection which makes us able to be healthy. And so getting knocked down by life really isn't the problem. It's getting back up. Connection being the key word here. Now that's at the micro-personal level. At the societal level, if we think of Aristotle's idea of the body politic and the social body as a body, the other way we can look at this in terms of mental health is not only at the personal or family level, but at the societal level, and recognizing that pandemics have happened in history before, and there's certain social phenomena which set up a pandemic which does damage. Sometimes, as in the medieval Black Death, the entire social structure was destroyed. And then we know, for example, when Sir Isaac Newton wrote his theory of universal gravitation, there was the plague in London, but it was basically a blip at that time because the society was much healthier. So really a virus like ours is pointing out the weakness in a societies. It's sort of, you could think of it, it's sort of doing us a favor to point out that there's things that we need to change, which we somehow didn't get around to. And I would bet that there's a bunch of positive change will come out of this at the societal level.
Good. So where I'm going to take it right now is just to give an understanding of mental health, mental illness, words that are often used interchangeably, but they are not interchangeable. And also to situate that in the context, because we have to look at mental health concerns and mental well-being in that context. So this definition of mental health, it's a state of well-being in which a person can realize his or own or their abilities. They can cope with the stresses of life. They can be productive, they can be fruitful, and they're able to contribute to community. So it is not a state of a blood test or a particular x-ray. It is a state of being. Mental illness, on the other hand, is considered a significant impairment in a person's cognitive function, their ability to think, their affect, their emotions, and the big one is actually relationship abilities. Their ability to engage with each other is a significant aspect of what it is to be mentally healthy or ill. What I wanted to walk you through quickly is, is Corey Key's work, which looks at mental health, what it is, and mental illness, what it is, and also in light of optimal mental health and illness. So it's a quadrant of 4 parts, not just a continuum of you have a mental illness or you don't. It's much more than that. And when we look at it in this dimensional way, we can also realize that a person can have mental health, but still have poor mental function, and they can also have optimal mental health, or mental illness, but have optimal mental health. It really depends on the context and what that person's resources are, what that person's supports are, and it's much more than a diagnosis, much, much more. So that's really important. And the work is that Corey Key's really talked about flourishing, that you could have had a mental health issue. You could have sometime in your life had a depression. 1 in 3 Canadians over their lifetime will experience a mental health concern in their lifetime, and 1 in 5 at a given moment. So this is a lot of our stories. This isn't unique. This is a lot of our people, a lot of us. And so therefore, but we can still have optimal health. And so we're going to look at the whole COVID experience within this model, where you can see that it's much more than just an illness. It isn't at all. So we can talk more about that if you have any questions about that model afterward. Because of this context, it's really important that we understand mental health in terms of social determinants. Again, there are many things at an individual level, at a social level, at an environmental level that will impact my mental health and well-being. And there are adverse factors and there are protective factors. And so really when we look at COVID-19 and all of this and how it's impacting our mental health, we have to look at it within that greater picture. What are some of those adverse factors? What are some of those protective factors? And hopefully by the end of the presentation, we'll really speak a lot to these protective factors that all of us, all 28 of us participants today in the presentation, will leave with a real sense that there are things that they can do to protect their mental well-being as well as others. So I kind of highlighted the things that are the issue right now in light of COVID. They are in red. Individual attributes, mental illness, substance abuse. Substance abuse is on the rise throughout the country, and that has been directly related to the stresses that people are experiencing right now. Loneliness is on the rise. Social isolation is bringing about loneliness, especially for communities older or youth. I mean, Gordon will send some examples of young people who are really feeling the sting of loneliness right now. Exposure of violence and abuse is high as well. People are now in close corners. Even the lovely family units are feeling the stress, and I put that in quotation marks because the incidence of domestic violence is definitely on the rise. People are experiencing issues with income, difficulties and failures at school. That is my domain as a prof. I am definitely hearing that students are struggling. The ideal of, hey, let's move everything online is not working for everyone. Work stress, unemployment, poor access to basic services. There's a lot of tension about healthcare right now that, you can't access services. Lots of people's surgeries are on hold, lots of diabetic care, other issues. Protective factors, though, are really important to look at too. Our ability to solve problems and manage stress or adversity is a huge protective factor. If we have this skill, and I'm talking to a bunch of people, 28 people who probably pride themselves in their ability to manage problems, and this is what is really important, our ability to deal with the everyday. Our physical health, the fitness that we enjoyed when we came into COVID, is really a protective factor. And also if we go through any other issue with stress, depression, anything like that. Our social supports in our family. Do we have friends that we can lean on? Do we have people we can call? When this presentation didn't work at the beginning, where there's someone we could ask. We could ask Art. There's someone. We need that. We need those kind of connections. We need a sense of physical security and safety. In this time of COVID especially, we need to feel safe in our homes and in our places of isolation, wherever we are. Economic security, I think that came out loud and clear, how that's really important. And if we didn't have that, that would just add to our mental duress. Scholastic achievement, the things that we have been successful for with my students, I lean a lot on that. I sort of say, listen, up until now, things were going along fine. We can get through this. We'll do it together. And equality of access to basic services is also something we need. So I want you to appreciate that as we look at mental health and mental illness experience. It isn't just that people are falling apart. It's not that. It's just that everything that we know and we understand, we have increasing adverse factors. We have our protective factors. Are they enough? Are they there? Are they supporting us and our community and those dear to us? So some examples that are current in the news, COVID-19 has led to social isolation and loneliness, which I spoke to. Holt and Lundstedt are in a very recent study, are the two independent risk factors for premature mortality. So we know that isolation and loneliness will cause premature death. So that's part of our story because of COVID. COVID has disrupted our social connectedness, our daily routines, our access to resources, and all of these are fundamental to core human mental health. Before COVID, we needed that, and during COVID, we still need this. COVID has made women and children more vulnerable, particularly if they're in abusive situations. The number one cause of calls by police in Ottawa right now is domestic violence. So it's here, it's palpable, and it's in our community. COVID-19 has fueled significant fear in the public, causing a fertile ground for unhealthy coping strategies, binge drinking, eating, excessive smoking. I have to say, eating, I'm like many of you, I am Zoomified. Every meeting at work, everything's always on Zoom, and I can't tell you how often people are saying that, oh my gosh, all I do is eat. It's just the nature of stress and the way we are. Binge drinking, all you have to do is, I live in the small town of Manotick. We can stand outside the LCBO. The line is long. It's just the nature. And then aggression as well is on the high. COVID-19 adds to our psychological distress, our sense of hopelessness and distress. And that tends to fuel the conspiracy theories. And you can certainly hear and see a lot of those. And Gordon's going to share a couple of stories too of a day in a life.
So these are some of the stories that sort of motivated us to do the presentation. The first one was from our daughter, who's an ICU nurse in Kingston. And one of the things you should know is when the nurses are properly resourced, like she is, she doesn't have any stress or anxiety because she's well-trained, well-educated, well-supported. She knows safety factors. So she's fine. But her neighbor in the apartment building she's in didn't go outside of her apartment for, was it 8 weeks? Around 8 weeks. She was too scared to go out at all. She would put her garbage outside her door, and my daughter would take the garbage downstairs. And I heard that and went, holy cow. And this girl was 21, 22. Another story is I've been teaching some classes of mathematics to a small independent school on Zoom. And one of the lads hadn't gone out. He was too scared to go outside for, once again, it was about 4 weeks. I talked to him and his mother and strongly encouraged them to go out, and eventually they went out together. But, when you have a, 14, 15-year-old too scared to go outside his door for a month, there's something not right there. And the third little story, to make this reality rather than abstract, is we have a cottage on the Rideau Lakes, and we wanted to go canoeing this past weekend. And so we rent out the cottage, and we said to the person who's there, said, look, we want to just walk by outside and go down to the dock where she never goes, to a canoe that she never uses, and just go paddling. And she was too scared to let us walk on the property outside while she stayed inside just so we could use the canoe and be gone. She was just too scared. So these are the real things that are happening. They seem excessive and unreasonable. However, if you have a radar, like I now have, you start to notice that there's a lot of this unhealthy coping going on. People are trying to cope, but they're not coping well. Back to Carmen.
To the impacts of distancing, there are impacts on our sense of freedom, our contact with our loved ones. Brooks, another recent study, this was in Lancet, spoke about the uncertainty over our disease status, the boredom on occasion created dramatic effects on us. Suicide has been reported, substantial anger generated. The potential benefits of mandatory mass quarantine, what we're basically experiencing, needs to be weighed against the possible psychological costs. Some of the psychological costs that are also coming up in the literature are severe depression, post-traumatic stress disorder, the inability to concentrate, substance use is definitely on the rise, high levels of fear and anxiety. So that's the whole gamut of lived experiences associated with that, be it obsessive compulsive, anxiety, general anxiety. And about 1/4 of Canadians have reported that their mental health and also their finances are significantly worsening. And so this is also adding to the mix. And then I just wanted to entertain, this is not a doom and gloom picture. It's definitely optimistic and it'll move in that direction. But we also have to think about what happens when we open the floodgates and people then now can speak to each other, engage freely in contact and touching, being together, no longer in isolation. Then we have issues of stigma. I was speaking to a nurse yesterday. I sit on the Canadian Federation of Mental Health Nurses, and there was one of my colleagues mentioned a story at the veterinarian. His dog, he wanted to bring his vet to the dog, and the vet suggested that he please not, he's a nurse, he's a mental health nurse, so he's not in direct contact in a hospital like my other daughter, who's an ICU nurse. And they asked him please not to drop off the dog because he's a nurse, and so he might potentially be a carrier. So please, can somebody else bring your dog to the vet? That's absurd, but that is the kind of things, and that stigma associated with being somebody who had COVID or somebody who had experienced it or worked with people. We got to think about that. What's that going to look like? And then, of course, financial loss and all of the other concerns that we have as well. So just to think about that. Just because I always think that learning, because my own research have a direct connection with this experience, can really give us a lot of insight. So I'm particularly interested in the group of people who have lived experience with mental health concerns and have come to flourish, even with that experience, because I believe that it's so rampant that so many of us have it. We need to learn from those that have had this experience. And interesting, I spent a little time in the literature looking at this particular story and perspective. And there are many people in the survivor literature, those who have had mental health issues, that say that they have had lived experience with mental illness and they are coping during these stressful times. There's even some arguments would say that maybe because they have had lived experience already with the challenges of life, this is like, okay, let's just pull up our socks and do it again. Life has taught them the coping skills to deal with issues without being overwhelmed. Some people are becoming, one of the writers or one of the people mentioned this, some people becoming newly acquainted with a life online and through their phones are having difficulty adjusting. For psychiatric survivors, this is often one of the few resources they have ever had. So they're not challenged in this because this has already been part of their life. Research shows that issues like post-traumatic stress disorder are not just reduced by making life safer, which is sometimes what we want to do. We want to just protect. And I'm a mother, for instance, mother hens, we protect our kids so that they're bubble wrapped and then they don't engage with life. Well, resilience is one of those qualities that you have to use a little bit of muscle mass in order to gain it. And so you have to have experience with the challenge in order to develop the muscle. So what we're saying is you need to have people be more resilient, able to cope with life's challenges, and the most important ingredient of resilience is social connections. Not that people can't feel alone, they need to feel supported and they need to be accepted. So these are the qualities or the things that's coming from those with lived experience with mental health issues during these COVID times.
Great. So we're moving on to part 2. I'm going to have to move along. One of my bias is looking at youth, so on the bigger picture. So Carmen's giving the details. I'm sort of going to zoom out now. Pun intended, by the way. So if we look at COVID, it's telling us about our society and how sick our society is. So a simple example is they discovered in the American South, because the population there, a significant chunk of the population has already pre-existing diabetes, high blood pressure, etc., because of poor lifestyle and diet, which often is because of socioeconomic reasons. They are more susceptible from getting COVID and dying from it. So it's really a social determinant of health issue. They also have employment where their finances are more fragile. And then, of course, there's more domestic violence and drug abuse and other issues because of that. So I want to see, it's really about the society, what's going on. An interesting little detail is, for example, that for-profit care homes are 4 times more likely to have a patient die from a virus than a public home. So once again, this is not just a medical issue. This is a reflection of our social structure. It's the politics of it. I'm a big fan of Singapore, having been there several times, and all of us, whether we're an individual or a society, has a soft underbelly. They dramatically stopped COVID-19 in its tracks. Everybody said, hip, hip, hooray, wow, look, aren't they great? But of course, they have a migrant population, which is their soft underbelly, and they kept them working, and they live in dorms close together, and they had to keep on going. And of course, the COVID-19 came back again in a second wave because that incubated the virus. So it's really, the virus is looking at the society. So think of it at a societal level. So I would call this a system failure. A good example is Liberia. they've had a huge increase in those with malaria going without treatment, and of course then some of them die because of COVID-19. So there's lots of evidence, and I'm not going to go through all the stories, but around the world there are issues of poverty and food and employment and not getting your blood tests done, where you're having pain and suffering and death happen indirectly because of that. And I'm saying that because I want to think of health not just as a physical health for somebody who's in a retirement home, but also think about the young people and what the word in finances, because all of these social determinants of health are health. So the expression mental health is health. So you have to include everything. This is a story from Central America, where that if they don't work in the way that things work down there, if they don't work today, they don't eat today. So there's lots of people in India, Africa, South America, who their employment has ceased. They have no social support, and their issue is food. I read an article in South Africa. They have lines for food several kilometers long, and of course, the what's happened there is there's a lot of problems with alcohol and cigarettes because of that. What they're looking at, this article is showing that there's the COVID massive scale where the number of deaths from these side effects could easily outnumber the deaths from the virus itself. And finally, I want to leave you with a question. And this is sort of a moral question. This was brought up by some other friends of mine. I certainly don't have an answer, but I read this article about a 14-year-old on a Saskatchewan reserve who committed suicide because of her fears because of COVID-19. There were also 10 other attempts at this reserve, even though there were no COVID-19 cases on the reserve. It was simply fear. I've also found articles that show that the damage being done to the youth in terms of employment and fear is actually more than those of us who are older and more secure. So it just raises the question, are we really sacrificing the rights of the young for the old? And I don't have an answer. I just think it's a worthy question. Carmen will now take over.
Okay. So, though we've painted a story, sort of the context again of COVID, I think it's important, and mental health within that story, or mental illness flourishing and languishing in that story. I think it's important that to weather this experience, to come through it, and to become more from it, because I do believe that these experiences of stress or difficulty can be also the ground, the very soil of which better comes out of it. So I think one of the things is we really have to work on building this resilience in ourselves, in our families, in our communities, in our country, etc. It just has to be. One of the things that's noticeable is, and my research has definitely shown me this among our emerging adults and our young adults, this idea that everybody has ups and downs in life. We're not immune to it. It's everyone's story. And for some reason, there's this false belief that life has to be perfect. And if life isn't perfect, then I'm flawed. And so that's the first sort of myth that has to go out the window, and that life does have ups and downs. This is a period that we're going through. There will be an up again, or maybe for some people, I would think if we talk to young kids, mom and dad are always home, there's things going on, I'm not going to school, this might be the up, who knows, but life has cycles is what's really important. Except that we cannot be in control all the time. And death is inevitable, for instance, and lots of things are. The need to be in control is one of the fundamentals of many of our mental health concerns that we face. And we need to let that go too. We are not in control of everything. Some things we just have to float with. Embrace change. Change is constant. I mean, my lived experience right now as a prof, every day they're telling us something different on how we're going to be teaching come the fall. I originally was told we are going to be teaching in the fall. Now I'm being told we might not be teaching until January, and probably later. Who knows? But it's always changing. If I sit there with this need to say that you said this, and therefore you can't change it, I'm ruined. I need to accept change. Be optimist. I know that sounds kind of plain, but it's true. You've just got to see the silver lining in things. You got to see that spring is coming. You got to see that this is the first year that Gordon and I have had time to really plant our garden. There's something good in this. And we have to look for it. You have to look for it. Find a sense of purpose in your life, whatever that may be. Offering your skills, your talents, wherever they are, in whatever place you can. That gives us gives us meaning. And meaning is the reason we get up. Meaning is the reason we do the things we do, why we engage, why we come and we join as 26 people on an afternoon on a Wednesday. It's because we have meaning in some way. Develop your problem-solving skills. I mentioned that before. It's really important. Build positive belief on your own abilities, whatever they are. There's many talents. Know what they are. Use them. Establish goals, short-term. What's today's goal? What's tomorrow's? All of these things are important for our resilience. Nurture your own well-being, whatever it is you need to do to take care of yourself. And develop a strong social network. Universally, the resilience research says we need to have a strong social network. The secret sauce in all of this human connection gives us for so many outcomes, health outcomes, all kinds of things, very concrete, but it plays a huge role in our.
I was, reading like Art does, and I found this article about this person who was really losing his marbles. And what they had noticed, this was out of the States, is that there's a shortage of dogs in the dog pounds out there. Everybody's going to the dog pound and the SPCA and getting a dog. Because number one, therapy. I mean, the dogs are therapy. It's so when people are depressed and lonely, if you have a goofball like this beside you, believe me, it's pretty hard to be permanently sad. And, works. So those of you who are alone, get a dog.
Yeah. Another little point is to sum up. I mean, what's good for our mental health right now, to be honest with you, it's minimizing news about COVID-19. If it makes you feel anxious, you can tell Gordon and I live with our mothers here, and watching the news constantly is not helping anyone's mental health in this family. So be supportive to others, and find opportunities to amplify positive and hopeful messages of the local people who have experienced COVID-19 or whatever is going on in your community. Share in the celebration, not just the terror or the scare, or the fear, but share in the celebration, share in the things that are going well. However, I mean, our little local community, our little small town, even going into the little Manotick and seeing people and how the companies or how the small businesses have reworked, retooled, rechanged, it's something to celebrate. So see it that way rather than the glass half empty.
So given that from all accounts, this is going to be with us a while, I wanted to leave you with something catchy, and this is the catchy expression we found, which was, so to keep your mental health of yourself, your family, and really of our entire society, we have to not confuse the two. We need social contact, we need interaction. It's as essential as air and drinking water. We need it to survive, to live. And that's our last message. We hope that we were able to help you, and we look forward to your questions now. Thank you.
Okay, and I've turned off your video there because we are having audio problems as well. So if you can turn your video back on, Gord. Now,
okay.
and what I suggest is that you close off your share screen as well. We'll try and save some bandwidth. And because I now have the opportunity, I can be the first to ask a question.
Stop sharing.
And
Good. There we go.
yeah, here I can probably help out here. And what we've got here is at least in my mind, is also an education issue with the number of changes that are being brought in almost on a daily basis that are emanating from the federal government, from the provincial government, from municipalities, and even individual companies and stores on the way that they're often and going to manage their business or their area. Change is, as I like to say, it's on hypersonic speeds. It's moving above Mach 5, and this becomes, I'm quite sure, very stressful for many people because what was happening yesterday is no longer valid, and something else is in place. So there is this thing that keeps going on in my head that says education is absolutely important, which says, how does this virus move? We know that it moves via touch and it's airborne. And therefore, all these rules and groupings and what all have you are directed at not picking it up and transferring it to your face via touch. And the other is stop breathing other people's air. Now, just even driving that home so people understand that's really what's behind all these regulations. I don't know how you get that across to people. Then there's the other dimension as well, and that is the dimension of time. That the longer you leave the virus alone, once it leaves the body, it's got a half-life of 1.1 to 1.2 hours, which means you leave it alone for 12 hours. I mean, it's way down. It's the particles that survive are way down below the threshold to infect you. So again, this is a type of education. I'd be interested in hearing Carmen comment on all this. Is there some mental health relief just by making sure people understand the nature of the disease?
Absolutely, absolutely. That's huge. We spend a lot of time with that and getting education out in simple formats and clear. I mean, public health is huge on this front, getting the messages out, because if we get the messages out clearly and quickly, we reduce the fear element, because the minute fear festers, then the mental health issues rise. So it is fundamental that we get good quality education out there from reliable sources, and we don't mix in there the conspiracy and those other kinds of stories that come out that just destroy the messaging. I mean, that's so important. I can't stress that enough. And I know that the health department is really involved with that, public health, as are the schools, as anyone wants to get the best message out. That exactly what you're saying.
I want to add to that I teach math, and math anxiety is the biggest block to doing math. And most people who don't do math, not well, it's because of their emotions. I think the same applies here. I think a lot of the messaging has been very basically fear-mongering, and that it guarantees that they won't hear the rational, sensible message. So the number one thing to do is to de-escalate the hysteria and the fear. The stories I gave you, the 3 people that I've met, they were in fear mode. So if I was to talk to them in a rational way, the information is not going to go in. So they first have to get out of the state of fear before the rationality can work.
Okay, I would like to just remind people that if you could use the chat box and to ask questions. We have right now John Hollins and Bill Pugsley has something to say. John Hollins, do you want to go ahead?
Thank you, Art. I've been puzzled by the approach that most public health officers have been taking in Canada. We in KCOR are systems people. We like to look at the whole picture. Medicine is fundamentally, certainly family medicine, is about understanding the functioning of the whole body and including some aspects of mental health. But what I've seen, with the exception of Bonnie Henry and BC and the lady in New Brunswick, I felt that the public health officer in the city of Ottawa, the province of Ontario, and the Canadian government, I got the impression they were setting out to scare us to death. And in some ways, it seems to me they have. So I have a question for Carmen and Gordon. If you were invited to participate in designing the qualifications that one needs in a public health officer in Canada, what approach would you take?
Well, I guess I would lean heavily just because of my focus, mental health and on all that side of things, that one cannot educate or teach in a place of fear. It doesn't happen. So you're absolutely right. If we create an environment where everyone is afraid, it will force us to be more controlling. It will force us to say, I have to do it exactly right, otherwise, and we won't have the logic, which is a bit what Art was getting at, like the understanding of how the virus works and how I can protect myself so that I own it. And therefore I can make decisions each day in each new situation. And I don't have to be told what I have to do in every situation. I can understand it. So I guess if I had the privilege of that forum, I would want to start from the premise of developing trust, developing clarity, and making sure that the angst accompanying with the threat. I mean, there are people who are very sick with COVID, and there have been deaths, but bringing it into perspective so that people understand that this is part of life, in a sense.
So would you like to join in writing a job description for the ideal Canadian public health officer and some criteria in order to select the best candidates?
Well, I think the best candidates would include the fact that you want divergent points of view. So public health is financial health, it's job health, it's small business health, it's domestic police. So I really think the focus on simple physical, X number of bodies dying in that way is very myopic and not thinking big picture systems enough. But to fill it out, you need people with different points of view to bang it out. Because health, as we said, health is all encompassing. It's at an individual, family, societal, it's economic, it's financial, it's all of those things are health. And if you don't put them together, you're going to actually unintentionally create, like in Liberia, suddenly everybody's dying of malaria. They're worrying about COVID, but actually the real issue is malaria. That kind of thing is happening all over the place. they've got the big in Bangladesh, India right now. They've got their big typhoon coming in, and the complication is, of course, that they're going to herd everybody into these safe places. And a bunch of people are saying, "Well, no, if I go there, I'll get COVID, and I won't go, so I'm going to stay on my farm and drown." You know, so you've got these things mixed up, and so you have to look at that mess as a system, and we're not doing that.
Okay, let's move on. We got Bill Pugsley, Mary, and Ted coming up. Bill?
Thank you, Art. I was stimulated by Art's question, and just to take it further and stepping back from the problem, the main challenge managing risk in terms of the instability that comes from having inconsistent direction or advice, and public people are the ones that seem to be giving it, and in some cases, to me, seem quite dogmatic in deciding something they don't know and giving advice, as in the case of the asymptotic spread. The first of this, which then suddenly became asymptotic without symptoms, and that meant that you could get the disease from people who didn't appear sick, which to me was a huge game changer in what the public at large sees as their risk. And it also carried on to who can get masks or not. And at first, the public health people seem to be wanting to keep all the masks for themselves and not have any for the public. And now the reverse is true, where countries and states and provinces are mandating people to have masks. So this is inconsistent, and to me, this is the core of the instability that exists in the public's mind about what their own personal risk is. Mm-hmm. Final point, I'm in the category where I have probably, according to the data from China to start with, those over 80 have more than a 20% chance of dying if they get the virus, whereas people under 40 have virtually nothing in comparison. So the point that you made, Gordon, about people being afraid to move out their house, I have a neighbor 2 doors away that has not been outside his house for more than, I think, one quick car trip for over 2 months. He just won't go outside. And he's younger than I am. So to me, this is the uncertainty, the going beyond education, basic education, the need for clear and consistent communication is a key role for me in interpreting what's going on. I'd like your comments on that, Carmen and Gordon.
I agree, but I'm gonna dare to do something that's coming from my therapist head. Okay, please accept it. Okay, I understand that is absolutely all true. We need to get the right information at the right place. And I think the intent of even these professionals in the public health world and elsewhere at the time was to provide that. They were wrong. There were mistakes made. Absolutely, there were mistakes made. But for me to continue to hold that and to say, how dare they be wrong, is only going to harm my mental health and well-being and my ability to be resilient to deal with the next crisis that's coming. So I have to accept that they are not perfect, nor is anyone, and they did, and that happened. It's wrong. But did we learn from it? Did we say, okay, that we need to do this differently now? That is a sign of a resilient society. That's a sign of a resilient system, a sign of good things. I'm sorry the mistake happened, but move on. And what do we do? I choose to focus on that. You're absolutely right. There are many people who are very vulnerable, and those older people, absolutely. In our house, we have two people well over 80 and we've been protecting them constantly, and that meant other family members couldn't come in the house, and but that's a choice that we made, and that's the way it is. But I don't know if I've answered your question, Bill. I don't think I can. I can't change that wrongs were made, nor can I own it, nor can they. But if the person or if the organization then willing to accept that change and do the right thing from that day forward, I see that as resilient, and that's a good thing.
Yeah. In resilience theory, you don't look primarily at making things safe, because your primary focus is when something happens to you. When you get tackled in football, because you're going to go hit the ground, do you get back up? Does somebody help you get back up? That's the focus. So the focus moving forward is to look always for the positive opportunities, and not, yes, admit there's some mistakes, but that's really the second or third on the list in terms of your psychological health.
But it's more than
what Carmen's saying, totally.
It's not to look for blame here. It's to encourage those who are speaking for public health or government to say when they don't know something and not be dogmatic about it. I think this is the problem. And there were two public health officers I noticed, the one in Ottawa, Dr. Etches, and the one in BC, Dr. Henry. They both, on occasion, would not stick to the script that they've been given. With Etches, she was asked how many people probably are infected in Ottawa, even though up to then the official word was, well, we've only tested this, 100 or 200 people. And she, without hesitation, said 4,000 at the time, that there were under 20 or 30 infected. This, I think, was honesty, and she was attacked for that, which I found is, not good. Similarly, Dr. Henry in BC seems to me have been quite honest and early in taking action, much better than Ontario. And the result is that BC now is the first to seemingly emerge unscathed, as it were, or relatively unscathed, compared to Ontario and Quebec, where stupider decisions were made. So the point I'm trying to make out is that people in authority have to be honest and upfront with what they know and the advice they give. And if they really are only out to protect themselves, which at first that mask thing seems to be only out to protect the nurses and doctors in hospitals, they're not the main issue. The main issue is the public at large, hundreds of whom are going to die, 6,000 now in Canada. So, a little honesty is what I'm asking for. And I'm saying this as a meteorologist, frequently asked for a 2-week forecast. I honestly say you can never go beyond 2 or 3 days if you want an hour-by-hour forecast. And I keep telling people this. You can't do it. And so the AccuWeathers of the world that go up for months are crazy. To me, it's not good.
Okay.
Exactly. Right.
Unless you got something really pertinent to say, we got 5 more questions waiting here. And I'd like to move on to Mary. You're next.
Hi, Carmen and Gord. You've been stressing the importance of social connection and social supports and resilience to help us stay mentally well. My question is to both of you, what are the top 1 or 2 things that you feel we have learned from coping in the last few months and should try to hold on to rather than go back to the old normal?
Mm-hmm. Mm-hmm. Well, I think one thing that pops up, just probably just because of what I've seen in the long-term care, I think we have really looked at, or we have to really look at how we organize care and what is and where is that. Understand the socio-political and economic realities, the critical theory, looking at how do we organize this, who's making decisions, why are they making the decisions, and why is it that we don't fund, for instance, PSWs, the bottom of the rung, and why do we not give them full-time work? And one of the reasons is because we didn't value them. So therefore, they went to multiple agencies or multiple places and spread. So I think that learning would be really important, to having that really critical perspective and looking at who makes decisions, when do they make decisions, and which goes even to what was the last question, because we don't do that enough. We don't look at, we just sort of accept what was said, and we don't really look at, well, why is that being said, and why is that being done? So that's one of the fundamental learnings for me that I hope happens. I also, perhaps too, a little bit, I mean, I don't know if this is everyone's experience, but I definitely see in the literature, there's been quite a bit about, we just slow down life's pace a little bit because we had to. And we've come to live at instead of going 120, we're now doing maybe 30 or 40, you know, and we're realizing, hey, we could live at that speed. Life can happen that way. I think too, maybe another one too, is some of our unrealistic expectations of what we think we deserve. I think that's been reflected. I mean, a lot of, you know, mass travel, the way that we go everywhere, we have to go everywhere. We have to be at the wedding on the weekend in BC. And I think now we're starting to think, well, you know, maybe we don't, you know, or maybe we can still celebrate and do things, but not on that frantic, chaotic rate, which takes its toll on our mental health and well-being. Those are just some thoughts that come to mind.
Okay, and our next question from Ted.
I can predict the future perfectly, plus or minus 100%. Problem is we don't know what we don't know. And whenever we get around risk, it is one of the most abused and misused concepts publicly. We've been trying for years to even describe in terms anyone understands the risks associated with something we know an awful lot about, which is climate change. And we're now in the middle of something where we really learn something new every day, or we learn we don't know something every day. So why are we surprised that people are distressed and afraid? So we really have a challenge that deals with anyone trying to deal with stochastic situations, with risk, with stuff where somebody we really trust can't stand up and tell us the absolute truth, even though they claim they can. So I guess I'm coming back to education will ultimately be fundamental to being able to address this issue. And I think it's probably worth having a nice debate at some point in future on this forum regarding how we actually could do that.
Mm-hmm. Yes.
Okay.
I would have to say amen.
Okay, the next question is from Fatah. Go ahead, please.
Yes, hi, Carmen, thank you very much. That was extremely useful information. Now, I have actually two comments. First one is about the criticisms that we are bringing to our healthcare professionals who are in authority concerning to giving us the information. Now, there's very little that we know about this virus, and we're still trying to figure it out, how we are going to deal with it, what is the best way of dealing with it, and what are the realities concerning this. Mm-hmm. So we should really be a little bit more forgiving about the contradicting or conflicting information that we are receiving. Mask, no mask, gloves, no gloves, and how long we should be isolating ourselves, how long, when we can open up, and how far we should be standing away from each other, and what have you. So this is all the facts of life that we are facing now. Mm-hmm. I think the most important thing is there is a balance between our inner selves and outer world. And this balance is sometimes being skewed in our day-to-day life. There's never a perfect balance that we can keep. But unfortunately, because of the virus, this balance is really skewed for a length of time. And this is one of the reasons that we are seeing people with anxiety disorder, generalized anxiety, and mainly depression and PTSD, which is going to be a major problem that we need to be dealing with when everything is done and finished with. So we have to be really careful about how much isolation that we can take, you see. And I think we need to take some calculated risks as we start getting on back to our lives. We human beings, we are social animals. We cannot live in isolation. This is the most unhealthy way of dealing with life, regardless the length. So we have to look at it carefully, and we have to see what is possible in our lives that we can be comfortable with. We don't know whether we are going to have a vaccine anytime soon. It has been rushed, and it has been rushed in a way that I'm worried about it. When we look at the history of vaccines, mumps is the, an illness that the vaccine has been developed the fastest. It took 4 years. And normally it takes 10 to 20 years to develop a vaccine that works. So now we have been informed that maybe we will be having vaccine within a couple of months. So I will be very leery to know how healthy this is. So maybe we will never have a vaccine. So why don't we look into the way of adapting ourselves to this virus, which is going to be with us forever? So I think, Carmen, maybe you can comment on that, how we can prepare ourselves for this. Thank you.
Thank you very much, and thank you for all the information, and thank you very much for also agreeing that with the idea that we do have to move forward. We be resilient, forgiving. I like that word. It's, I think, fundamentally, again, as a mental health practitioner, the first thing in order for anybody's mental health and well-being is the construct of forgiveness. There are times, things you just have to let go, move on, and get on with your life. And I agree 100% with that. In terms of again, I think a society that is healthy mentally, that can deal with uncertainty is what we need. We can't go through life thinking that we control everything. And you're absolutely right. We don't know this virus outcome. We don't know what the next virus will be. We don't know what the side effects of the vaccination will be. We don't, I think we're still battling about autism and vaccines. There's all kinds of stuff out there still. So you're absolutely right. But if we, as a people, work on strengthening ourselves, our fortitude, having those relationships so that we can trust and we can live in that uncertainty, which is inherent into life. Change is inherent, everything. Then we have a chance. But if we don't work on that, the best laid plans, we're just going to come at them with incredible need for control, or fear mongering, or any of those things behind it. And then even if a perfect vaccine comes out, there will be a conspiracy, there'll be all kinds of other stuff about it. So I think the self working on, or the community, the well-being of our people so that they could trust, feel safe, have those social determinants there, then we have a chance. It's a grandiose, but I do believe that.
Okay.
I'd like to add to that and saying that our experiences, we have our mothers living with us who are over 80, and they're basically quarantined in our house, but they're that doesn't really bother them that much. Their bubble is basically going up and down the driveway and maybe going for a country drive because of this, but it didn't make much of a change in their life. So the quarantine for them is not psychologically damaging. It is for my daughter, who's 24 and moved to Kingston, and she just moved, and now she can't see any of her friends because she doesn't have anything established, and she's alone and lonely and can't do anything. So, and then this sets up this question of this generational justice. I mean, the youth are minimally at risk. There are some who are, but the vast majority are not. And they're suffering the brunt of the pain and suffering and damage. And I don't think that's right. I really think that's absolutely wrong. And this is actually, in some ways, a relatively simple virus compared to, let's say, the Spanish flu, which killed everybody, especially if you were healthy. This one is very clearly age comorbidities oriented. So there's a lot to be said for saying, you know what, there is a difference in terms of the health impact in different populations. We have to therefore behave appropriately for the different populations and treat things differently. And I think it's very political as well. I think that, as Carmen said, control. People on this forum know that I'm a big fan of this, more the Swedish approach. And it's because in a democracy, people need to be given whatever maximum amount of decision-making information so they can decide. Papa knows best, and the state knows everything best only without the participation of the public is really fundamentally undemocratic.
Okay, let's move on. Then we've still got a couple of questions. Susan, are you ready? You're up next.
Sure. Am I unmuted? Oh, great. Okay,
No.
Thank you so much for that very thoughtful presentation. And I particularly like, Carmen, your talks about social networking and that support. And I'm part of a peer counseling network. And what I have found, exactly what you're saying, when people are in the middle of a big emotion, whether it be fear or anger or whatever, they can't think rationally. And what we have found, the most important thing is just listening, and listening in an open and non-judgmental way. And I found out how seldom we have people listening to us, like really focused on us and listening to us. And when people do find that you're able to do that, they want to hang around. You could do it all day because there's such a demand for it, just to have that listening, because they want to get out of that distress. Yeah. And the other side of the fear I wanted also to comment on a little bit, like Patos Baudouin, the woman that was speaking about the mental health experts, because I'm very worried about our tendency to expect perfection that you mentioned, not only of ourselves, but of our leaders, and none of them are perfect. And they're in a whole new area. And all of a sudden they've become media stars. They didn't sign up for that. They don't have media training. They're worried, very worried about what they're saying, how that will affect the population, et cetera, et cetera. So, and I'm very wary of scapegoating them in our fear and anger because it's not their fault. And I'm particularly worried about it because they tend to be women. Mm-hmm. And I'm very admiring the leadership we have had from so many really competent professional women all across the country. They're household names now. They're very important leaders. And when you look at the kind of horrible email that female politicians get, the bots, the right-wing assholes, I hope we don't have get in trouble for that, but I mean, it's just amazing the kind of harassment they come under. Is that I get very defensive for those medical officers of health. I think we ought to be valuing them and celebrating them. Thank you.
Thank you, Susan.
Carmen, do you have any reply before we move on to Vic?
Again, I think what Susan shared, the first part was about needing to listen. A lot of the tension and a lot of the fear and a lot of the issues that are at a societal level even are resulting from people feeling that they're voiceless and that they don't have a place. So if we allow for that, and if we give that, again, the social well-being and health of our community, etc., will be that much better. So I agree. The fear that people experience, like, needs to go somewhere. It's an energy. It needs to go somewhere. So it needs an outlet. If it stays in, if it festers, it becomes illness. And initially it might be a mental illness, then it'll be a cancer, then it'll be something else. So it's important. So thank you, Susan, for sharing that.
Okay, let's move on. Vic, you're next.
Oh, I think Vic's on mute. Is he on mute? Yes. Thank you.
Try again, Vic. Unmute yourself. I won't mess with you.
Oh, shit.
Try again. We're still not getting you. There you go. You're unmuted. No.
We can't hear you.
Does he want to write his question?
Yeah. Maybe you could put it in the chat, and I'll speak to it. Your microphone is dead. And in the meantime, John Hollins had put in another comment. John?
Am I muted? I can't remember.
Yes, you're unmuted. Go ahead.
Yeah.
Look, Bill, you referred to the public health officer for Ottawa, and you were right. In mid-March, she anticipated 4,000 cases already existing in Ottawa, and at her briefing the next week, she speculated that there could be as many as 16,000 a week after that. I've just looked up the report for Ottawa. Yesterday's report, there were 1,824 laboratory confirmed cases. So the actual numbers are not in the same, are not even in the ballpark. They're in the next province. So what Dr. Etches had to say in mid-March was at best hypothesis. No evidence was offered at that time, and it was subsequently shown she was simply wrong. She did not know. She was not honest with me. I acknowledge that she has a tough job, but frankly, she lost my respect long ago. Over to Bill.
But John, I pointed out her as an example of being honest with the public. We know from the start that this virus will eventually affect 70% of the population. We are over 1 million people now in Ottawa. 70% means 700,000. And so instead of concentrating on the tests, which have only been administered to people that have symptoms, and that's all it represents. It doesn't represent anything more than that. Let's look at the asymptomatic population, which most people, from my reading of public health, is 20 or 30 times more than those that show symptoms. So I think she was quite right. And unlike you, she immediately got my respect for not following the party line and being straightforward and honest with the public.
Somebody who can present numbers so wrong doesn't gain my respect. I should have studied meteorology.
They're not wrong.
Let's first of all, I think the numbers game, my brother's is an engineer, MBA type, and he's been trying to convince me with numbers for the last 2 months, and he's finally come to the conclusion that as of now, all the numbers in the world mean nothing, because there's such an incomplete database. You can't compare what one country does to another country, so forget about it. Even the number of deaths are often wrong because they're not counted, they're counted differently, so forget numbers. I want to go on to the question here from Vic. Vic says he's on now. Okay, so Vic, are you on now?
No. Oh, shoot.
Hey, Art,
No.
can you put my video back on? It's David. Thanks.
No. Anyway, Vic typed in a question, says, Kingston has not had a case confirmed for weeks, yet Ontario has, oh, that was John Hollins.
Yeah.
Okay, I thought that was Vic.
No.
All right, so I don't have anything from Vic, sorry. All right.
Okay, let's move on. Vic is still having problems, and let's go to John Glegg.
Thank you, Art, and thank you very much to Gordon and Carmen. I'm not sure who I should direct the question to. Gordon, you actually touched upon one factor just a moment ago. This is called, my question is based on my 31-year career, that is, as a Canadian diplomat, and we try, when we're abroad, to get a very good reading on what's going on in that particular country, and we concentrate on leadership and the government and so on. My question will be, but I'll give you a bit of background first, the role of leadership in terms of maintaining a rational atmosphere. And here I am thinking about a question where all Canadians believe they can contribute, and I'm looking south of the border, that is to say, leadership. And I came to a very simplistic answer a number of days ago, and I realized how simplistic it is. I think we in Canada have a great advantage. We have on display a cooperative leadership. It's clear that there is a great deal of cooperation between the Prime Minister and the Premiers, whereas south of the border, it's also clear that, in fact, Trump relishes controversy and maybe even conflict. And so I suspect the answer to the question really has to do with what Obama said just a few days ago when he intervened publicly, and his main point seemed to be that the top people in Washington, D.C. seem now to have even dropped the pretense of being in charge. But I nonetheless, because of your expertise and the fact that you're concentrating on this area, I would be interested nonetheless in your general observations about the role of leadership south of the border. My own simplistic, but I think it really was simplistic, was that, well, Trump is going to show what an idiot he is. Well, then most Canadians know that already. So, and in the end, he will lose out by showing himself to be an idiot. But I think that is too simplistic, because his base are probably still enamored with him, and those who don't believe in him even less. But I better limit myself there, and please give me your views on the role of leadership in the whole question of COVID, in terms of maintaining some semblance of a rational atmosphere for discussion. Thank you.
Well, I would probably bring it back again to the whole definition of mental health and well-being, and that one has to have cognitive, emotional, and affective, emotional relationship. They have to be in working, functioning in a way that you can contribute towards the well-being of your community or wherever you are. And and I think that we also, that happens on all levels. I mean, we also look for that in our leadership. We look for that within our family leaderships, our own. We know that when things go awry within our own family units, our parents, if they have health issues, or they have mental health concerns, substance abuse or whatever, then it has impacts on all of us. And I would say the same thing with leadership of a country. I cannot speak to, again, I won't venture off outside of my own country because that's an issue of control. I don't have control over that, so I'm not going to spend time with that one. But I would say that we do expect that. We do expect a healthy, rational response to issues. And we want our leadership to do that. And if we don't have that, I do believe it spills out into the people of the community. It absolutely does. And I think we might witness that in other countries as well. There might be issues of that sort. I mean, you're asking a question that's probably beyond the scope of this presentation, but I do think that you sense in your question the issues of when a society is struggling with health issues, mental health issues. It spills out. It just spills out, and there's a tension among everyone, and that breeds more discourse and more difficulty.
I want to sort of do a counterpoint to that, is that I think while we have had a nice, good style in Canada in terms of this crisis, the actual content and results and actual real decisions have in no way resulted in superior results in the ground vis-a-vis the US. We, right from the get-go, I would say Canada, having lived in other countries, we have good managers and followers as leaders, but we don't actually have leaders. I will refer to the following definition. A leader brings a group of people to a place they would otherwise not go. And our leaders are basically followers and managers. They aren't leaders. A leadership decision, as an example, would be, which would have been very hard, is that when the 1.3 million Canadians returned home from everywhere in the world, and our leaders said, "Come on home, we welcome you with open arms," who then proceeded to infect the entire country, there was no mandatory screening or quarantining done as in countries like Vietnam, who took it seriously. We did the magnanimous, wonderful, yes, we feel good, but on the ground, there was no leadership. There was no hard edge. And I've lived around, that's the Canadian culture. So it does accurately reflect the culture of Canada, but I would not call that a success. I think calling that a success is being grossly complacent, which is once again a Canadian characteristic which I have observed.
I just want to intercede here that you can speak to my son, who was one of the people who returned to Canada, and he spent 14 days in a hotel lockdown in Montreal. So
that was way late in the game. That happened way too late in the game. We met tons of people around here who came in from wherever, and they didn't quarantine. They didn't do anything. So
okay.
Anyway, that was a government.
Let's move on. We have David. David, go ahead.
I was just going to comment on this leadership issue briefly. I've been following, I don't know why exactly, but Carol and I like the PBS news station. I've been following a lot more US news than I probably should. But Dr. Fauci, has been exerting an interesting kind of leadership. I mean, first of all, it's medical knowledge, but he's also managed over a long career to speak some truth to power. So to be able to not get fired when Trump is your boss is kind of an outstanding achievement. And he's been able to correct different positions of Trump at different points. So I think from that point of view, and I think people that I've sort of polled informally, a lot of my friends and colleagues, the last person they would have voted for in Ontario was Doug Ford. But they have seen him perform way better than they thought that he would. And in part, he's been willing to delegate a certain amount of expertise, and he's not always trying to take the limelight. And I think that Governor Cuomo in New York State, if he ran for president today, would have a fair chance, in that he's taken a very difficult situation in New York, and he's had these daily lengthy briefings. And the hallmark of his leadership, I mean, you don't think of it normally as leadership, but it's been simple transparency and clarity, and people trust the integrity and honesty. So those are very low bars in terms of leadership. But I would say that surprisingly, Ford has demonstrated more than a lot of people thought. And I think that Trudeau has not done bad either in terms of a lot of his public transparency, where people aren't trying to score huge political points, at least in an obvious way. So, I mean, I think I agree with you, Gord, that there's sort of more in-depth forms of leadership, as you know, in certain examples of getting people to go somewhere they might not otherwise go. But I think in this crisis, the thirst on the part of the public is for, tell us the truth, don't score points, don't be reassuring if it's false. And I mean, I think I listened to 3 summer camp owners that ran summer boys camps and girls camps, who were all expecting to open. And while it was a small political decision, the fact that Ford said, no, I'm not going to, in this equation, put people at risk, and consequently, we're going to keep summer camps closed. He was under an awful lot of pressure to get those open. And I think, you know, some of his background in terms of favoring the economy over social welfare has really been reversed in this crisis, where he really is trying to put health ahead of sort of sheer economy. In the case of Trump, I think he's done the calculation that so many of the people who are still to be infected are people who are not going to vote for him otherwise anyway. And that the people who are going to vote for him are those that are clamoring to reopen the economy. And he may be proven right. I don't think it's a slam dunk that Trump will lose the next election at all, which makes me very worried. But those are just some comments I wanted to pick up on. I had to do other things, but I was listening throughout, and I've enjoyed the discussion and presentation. So thank you very much.
Okay, Carmen, do you have any comment?
No.
No, I think
Okay, we have Fatah, you have more comments?
Yeah, well, very quickly, I think what we need to do now is stop pointing fingers. You know, I don't think that this is going to bring us any good. So who gave the false information and who gets our respect and who doesn't is extremely irrelevant. Now we know that the poor and the disadvantaged is going to suffer from this virus more than anybody else. So our objective needs to be to concentrate how we are going to move on and how we are going to reconstruct our economy, how we are going to put our lives together, and how we are going to manage to surcome all those problems, mental health problems that we are going to face as we are opening up the economy and the social interactions. So these are the important problems that we need to solve, and this is where we need to concentrate. And that's all we can do for the time being.
Okay, thank you for your comment.
I'd just like to add that I think the one thing that COVID taught us, which we also presented in the thing, is that we're only as strong as our weakest link. And that's absolutely true. And so if we have vulnerable pockets of people in our community that are more vulnerable to COVID, well, it's everybody's story. If we have more vulnerable community or areas in our country that are more vulnerable to some of those social distresses that I talked about, that will impact all of us. It isn't over there, it is us. And that's
Exactly.
COVID showed us that very clearly. COVID showed about that today.
Absolutely.
All right.
Okay, let's try Vic one more time, see if we got you. No audio, no audio, Vic. Sorry, still not coming through. Okay, Mary, you've got a comment.
I'm going to bring up my favorite subject. At the beginning, Gordon, Carmen talked about 3 major things that were social determinants for mental well-being. And we talked about the social circumstances, individual attributes. And their third one was environmental factors.
Mhm.
And I don't know whether you addressed the environmental factors, so I was curious what you meant by that.
Well, environment both can mean that where the person finds themselves in the case of that model, sort of the social determinants, but we do know that in environments, I mean, if there is no running water, I'm fortunate to work again with the Canadian Federation of Mental Health Nurses, and one of my colleagues is a mental health nurse working with the Indigenous community, and she basically told me, can you help me get some resources to deal with COVID? And the first one was, and how do you do hand washing in extreme poverty where you don't have running water, which is something that most of us in Canada consider. So environment takes a place that like that in our country, that we need to look at that, you know, because it's true, you cannot afford to just pump, you know, alcohol pumps everywhere, you know. So I mean, hand washing that way, you need to have running water, you know, you need fundamentals. And so yes,
We're not she's not meaning environment as in trees and the birds and the bees, just to be clear.
Okay.
Not talking about
You
that.
mean the context, the total environment?
the
Yes.
total context where a person finds themselves. But yeah.
Okay, at this stage.
Mind you, trees and good air is not a bad idea.
Yeah. But they